Welcome to Macmillan 180. For nearly the past 25 years, students and faculty of the University of British Columbia's Animal Welfare Program have gathered here to share ideas, learn, and enjoy lunch. To celebrate our 25th anniversary, the Animal Welfare Program hosted a series of webinars to virtually invite our diverse alumni to join us once again around the table to ruminate in Room 180. My name is Megan Locke, and I am the Animal Welfare Program's Communications and Media Assistant, and I will be the host of today's podcast. On November 7th, we were joined by Alex, Dax, and Art to discuss how to achieve change for animals in veterinary practice. Alex Boo obtained a bachelor's degree in the Applied Animal Biology Honors Program at UBC and went on to graduate from the Western College of Veterinary Medicine in 2018. Since graduation, he has been working at a clinic in Vancouver and has a special interest in dermatology and internal medicine. He started as an adjunct professor at UBC in January 2022, teaching upper year undergraduate students in shelter animal health and welfare. Dax Atkinson obtained a bachelor's degree in applied animal biology, which included a summer research term at the Dairy Education and Research Center. Dax continued with research related to dairy cows by completing his master's with the program in 2016. He then pursued a veterinary degree at the Western College of Veterinary Medicine and has since returned to BC as a small animal veterinarian. Art Ceballos chose to go into veterinary medicine after a career in the Canadian military, and he obtained his master's in the Animal Welfare Program in 2003. Art then graduated from the Ontario Veterinary College in 2005 and started his veterinary career in a small animal practice in Ontario. For the last 16 years, he has worked in small animal practice in Richmond, BC, and is currently a partner in 2 busy practices. Many students who join us during their undergraduate degree go on to become veterinarians like Alex, and many graduate students in the AWP come from veterinary backgrounds like Dax and Art. These speakers discuss their journeys in entering the veterinary field, the value of animal welfare education and veterinary practice, and some practical insights that they have gained from their current roles. Alex's favorite memory from his time with the AWP happened during his undergrad, where interactions with professors in our small upper year classes helped him find his passion for animals. We have 15 courses and counting available for undergraduate students to take and delve into animal welfare.
For me, I'm just going to speak more about my experience in the undergraduate program. And I think at UBC, when you have so many students, things can really get overwhelming when you're in a lecture of 200 or 300 or 400 people. So just coming here was really refreshing to have professors address you by your first name, which I know now is incredibly difficult. But I think also having just that one-on-one attention that you wouldn't get in any other program or faculty, area, because you kind of, as an undergrad student, a lot of us are in our early 20s. And so as part of the formative years, we don't really know what we want to do. And a lot of people don't even know if they want to work with animals. I think the beauty of this program is it attracts people from so many different walks of life. And really, for me, it was just affirmative in that this is the path that I wanted to follow. So I'm really thankful for that.
The audience was curious to know about how to integrate animal welfare into their path to becoming a veterinarian. Dax talked about the unique paths that veterinarians can take in both their education but also with their careers.
The way to think about it isn't, I need to take this program or be part of this program because I'm interested in veterinary. I want to be a vet. In some ways, it can be the opposite, I think. It shows you a lot of avenues and areas that are out there other than directly practicing as a small animal veterinarian. So obviously, there's a lot of veterinarians not doing actual medicine practice work, and that tends to bleed over into animal welfare, hopefully for most of them. But generally speaking, I think it's an amazing place to see all of the other areas that we need people thinking about animals and branching out beyond what happens in a practice. Going back to should I pursue that kind of career path? A lot of that comes down to being directly in there and getting direct experience with that career path. Like Alex said, getting into a practice and seeing what happens hands-on and really understanding all of the good and bad. You're not going to get that here. You're going to get a much wider range of things, far beyond. You'll see different perspectives on veterinary. As a future veterinarian, it can give you a lot as well and give you unique perspectives. But for people, I know lots of people obviously are interested in veterinary. And as far as programs go, when they look down the list at a university, it's going to be biology, or in UBC's case, applied animal biology sounds like a natural fit. You're not pigeonholed though. I mean, technically they don't care as long as you meet requirements to get into any veterinary college, just like medical. They really don't care what kind of actual program you follow. So it shouldn't be something you're just pinning everything on that goal, because it'd be such a waste, honestly.
Art also agreed that animal welfare education at some point in one's journey to becoming a vet is beneficial when learning how to best provide care. He talked about how, as science progresses, he has noticed that the standards for animal welfare in veterinary practice have changed.
From my point of view, I look at it more in a practical point of view and the way things have changed. And again, because I got into this fairly early, so I've seen things evolve over the years. And I mean, when I was here, there was still discussions about, as crazy as it seems, well, do animals feel pain? And even a lot of old school vets at the time didn't necessarily believe that, which is crazy to me. And now that's not really even a discussion anymore. So, and on a practical point of view, it just impacts the way I deal with things every day. To me, the default is just assume that there's discomfort there if there's any chance, and kind of act proactively. And it seems like such a simple and obvious concept, but that wasn't always the case. And just even bigger picture things like that, like over the years, you see the CVMA or whatever regulatory bodies actually started to take positions on things like cosmetic procedures on patients, on dogs, and that sort of stuff, which again, 20, 25 years ago, you'd be looked at crazy if you suggested that dogs that need their ears cut off and that sort of thing. So I guess my point of view is just we're actually seeing change, and it is good over the long term to see us moving in that direction.
Animal welfare also comes up when people and their pets visit clinics for checkups. Alex touched on natural living, as well as how veterinarians can make changes to improve the welfare of animals during checkups. Natural living is one of the 3 spheres of animal welfare, a model developed by our very own Dr. David Fraser and colleagues. It refers to allowing animals to perform natural behaviors in an environment that also mirrors or contains natural features.
I'll maybe touch on 2 things. So the first one is the tying into the natural living state of animals. So when we have animals come in, specifically cats, if we see, I tell all my staff, hey, don't put the carrier on the floor, put it on the table or put it on the chair. We have separate cat and dog wards, for example, to minimize the noises that do truly scare them and increase their cortisol, and therefore can increase their susceptibility to diseases. I like to kind of think of things in terms of herd health as in clientele. So what kind of conversations are we having with clientele? In a number of years previously, it used, and a lot of clients are still this way, but they assume that my words and my instructions, that's what they have to follow. They don't have choice. And so a lot of the conversations that we are now having are to be, well, check in with me if this plan doesn't work. If your cat or dog runs away every time you try to put eardrops in its ears, and I'm telling you to put them in 3 times a day for 7 days, that's just not doable for not only your welfare, but also your animal's welfare. So really, it's about checking in and having that one-on-one communication with the client and with the pet as well on, if things aren't working, then check in and we can make changes.
Our speakers continue to discuss current practices to reduce stress and anxiety in our pets through the use of science-backed medications.
I think we have a lot of ground to cover in the future, but we certainly are on our way. Definitely the use of pre-medicating with gabapentin for cats and trazodone for dogs has a lot of evidence towards it. And even just when I was an undergrad student 10 years ago, we would use the cat gloves and the cat bag and all of those methods to try and essentially perform what we needed to perform. Whereas now there's a paradigm shift towards using pre-medication, not only in private practice, but also in shelters as well. And that the hope is that we can decrease these triggers to a level where maybe we can work with them a little bit more, or if it means that they have to come back for another visit, then that's what it is. And, a lot of diseases, I think, are also coming up more and more, especially with COVID cats and dogs in regards to anxiety, feline idiopathic cystitis. A lot of these behavioral issues are actually inherently linked to their stress and their biological health and functioning.
20 years ago at OBC, gabapentin and trazodone weren't a thing. And the idea of dealing with anxiety honestly wasn't a thing. I guess just on the bigger picture, the idea that we're not just worrying about disease, a lot of times you end up talking to owners about the anxiety that their pets are having, and that's a cause for various diseases. Yeah, feline idiopathic cystitis is an easy one to talk about. And it's cool to see the shift. Yeah, gabapentin, man, that stuff goes out by the gallon because it works. And trazodone, same thing. It works for dogs. And who knows what will be in 10, 15 years because that progression is going so quick. And it is cool to see that transition.
Alex also suggests that having clients improve their relationships with veterinarians is important because both client and veterinarian can develop a better understanding of how to make regular visits easier on their pets.
The relationship that a pet has with a veterinarian is a long-term relationship. It's not a short-term relationship where you just come in once a year and we give them their shots and they go home. It's hopefully a process where it's an ongoing conversation.
Even beyond improving animal welfare during individual visits, Dax discussed that, in an ideal world, the whole veterinary clinic environment could be improved to better serve animal patients.
Maybe just on a simple level, it's not really practical, but since it's not a practical question anyways, it would be figuring out ways of designing clinics that work for the animals better, where barriers might play a factor, the smells, the sounds, all of those things. The second part of that, though, is much more impractical. Even beyond that, though, is the time, I think, because we just don't have the time of day to give them that they might need to be able to relax, whether it takes multiple visits and the time to have them settle before we need to do things that we need to do with them or look at them and poke and prod them and stress them in those ways.
Alex also highlighted how critical the well-being of veterinarians is in ensuring the best possible care is provided.
So my answer is not really animal related, but human related. So everyone knows that the mental health status in the veterinary industry has been quite impacted by COVID. I think surveys in the US at least have shown that at least 80 to 90% of veterinary professionals have expressed some level of fatigue or compassion fatigue or anxiety or even, thoughts of depression and suicide. And so I think with all the resources, even if we can get all these animals in tip-top perfect shape, if we don't have the veterinarians to support them, then how is that going to bring us to a good conclusion? So I think that there is a lot of work that needs to be done, not only in academia, but also in practice as well, on how to select veterinarians who are resilient and not necessarily just selecting people who have perfect resumes. And our academic world is changing in that we need definitely more emphasis, on having work-life balance, and how does the employer portray that to his or her associates, and what that means in terms of how to make this a long-term career rather than have people, jump into the career of their dreams and then burn out within 5 years. So I think that's a really deep discussion to be had, and definitely something I think I wish in the future that we can hopefully address appropriately.
Overall, our speakers discussed how the skills required for veterinarians are incredibly diverse, and animal welfare education can encourage vets to develop a more holistic understanding of how to best support animals and their owners, both during and after vet visits. To end off, Alex and Dax left some general advice for current and future students of the AWP.
So my current advice to people wanting to and people who are already entering the animal welfare program is absorb all the information that's given to you. I guess as we proceed in life, there is a lot of isolation and there's a lot of tendency to work in silos. And so when you're in an area where you're just working on the same thing every single day, things can get quite mundane and it can be difficult to have a positive outlook on things. So I would say it's a fantastic experience and a form of identity that I think the three of us have formed here, and we're really lucky to be able to say that.
I don't think I can add on too much to be that, but it's definitely true. But it goes back to, I guess, almost anything, is just taking advantage of what's there. As an undergrad too, it's a fabulous opportunity to really see that link of what could be some next future steps, right? And you can see directly, and you can talk to them in this room over those lunch hours that we already were ranting about, right? So it gives you an opportunity right there to start to see some paths open up. You don't have to be in your early 20 formative years, I can attest to also not know where you might go in life or have any clue. So it definitely gives you that chance just to see how opportunities might open up in front of you.
Thank you for listening to our November podcast on achieving change for animals in veterinary practice. You can find the Animal Welfare Program on our website at www.awp.landfood.ubc.ca and on our Facebook, LinkedIn, and Twitter social media channels. Join us next time for an episode on achieving change for animals in Latin America.